So today, I want us to deal with approach to chronic abdominal pain. Chronic or recurrent abdominal pain, that is the objective we are dealing with today, is a common symptom, okay? And whenever we are looking at these things, I always say that focus on the words, focus on the way they've expressed things. It's a common symptom with an extensive differential diagnosis and heterogeneous pathophysiology. So that means, number one, it is common. And I always tell my candidates, common things are common, right? So if it is common, you must pay attention to it. And the pathophysiology is also heterogeneous. So there are so many causes of chronic abdominal pain. Now, the history and physical exam frequently differentiate amongst the causative disorders. And so these are things you have to start asking yourself. Okay, so the medical council is telling me that it's a common thing. So if it is common, common things are common. All right, I'm writing it down. Number two, it has extensive differentials. So if I see any patient with chronic abdominal pain, I should be able to list some critical differential diagnosis for that particular patient. Number three, I should be able to, based on history, physical exam, and the way the patient presents, be able to tell the difference between various types of conditions which present with chronic abdominal pain. That is it. So they usually will give you some causative conditions. Causative conditions can be, for example, in the upper abdominal region, it can be malignancy, it can be ulcer and non-ulcer dyspepsia, it can be biliary disease, it can be pancreatic disease, and last week we did pancreatitis, right? So, as well as hepatic disease, and it can also be due to referred cardiothoracic pain. And then, if you go to the lower abdominal region, there is inflammatory bowel disease, there's diverticular disease, there's irritable bowel syndrome, which you've also dealt with. Okay, there can be GIT malignancy, and then genitourinary disease like dysmenorrhea, benign or malignant tumors, and other causes. And those other causes can be food allergies, food intolerances, constipation, musculoskeletal pain, and functional abdominal pain. So if you want to ace this objective, what you need to do is to make sure that you've mastered each of these cases. So biliary disease, you want to make sure you understand biliary colic. You want to make sure you understand cholecystitis. You want to make sure you understand cholangitis, right? You want to make sure you understand um, um, pancreatic disease like chronic pancreatitis, acute pancreatitis, pancreatic cancer. All these topics, you want to make sure you have managed them. Hepatic disease, you want to make sure you've dealt with hepatitis, the various forms of hepatitis, drug-induced hepatitis, viral-induced hepatitis, hepatic liver abscess as well, liver cancer, hepatomas, all those things. So all of them fall under just the hepatic disease alone. All right. And today I've just highlighted on diverticular disease because I want us to take our time and break diverticular disease as well down so we can be able to appreciate it very, very well. Okay. So the key objectives for this particular objective is that given a patient with chronic abdominal pain, the candidate will diagnose the cause, the severity, and the complications. So with all those conditions I mentioned, make sure that when you are learning them, you learn them in the context of what is the cause of this. So for example, if you have cholecystitis, what's the cause of cholecystitis? How will I determine the severity of cholecystitis? What are the complications of cholecystitis? How will I manage a patient with cholecystitis? If you're able to go through this framework, then that means that you are dealing with this particular objective properly. So, given a patient with chronic abdominal pain, we have to know the cause, we have to know the severity, we need to know the complications, we need to know how to initiate an appropriate management plan for that particular patient. So, now the enabling objective is given a patient with chronic abdominal pain, the candidate, that is you, Dr. Zoe, Dr. Equia, Dr. Alinus, Dr. Khadija, okay? You, the candidate, will list and interpret critical clinical findings, including those derived from a detailed history and an appropriate physical exam. Then list and interpret critical investigations, including laboratory investigations, basic and advanced imaging, and endoscopic evaluation. Then they go on to say, construct an effective initial management plan. Why is it initial management plan? Because this is an exam at the level of a Canadian medical student. So if it's at the level of a Canadian medical student, at least the Canadian medical student must know how to manage a patient who presents with any of these causes of chronic abdominal pain. That student must know how to deal with that patient initially, how to keep that patient alive before, if there should be any specialist consultation, it is done. That is why it always states effective initial management plan, including appropriate medical, surgical, and non-pharmacologic management. And then determining whether this is a case for which long-term follow-up is required due to the risk of later complications. So as well, if I'm learning this particular objective, I'm also going to pay attention to complications of the condition. And then recognition of possible underlying psychosocial issues leading to abdominal pain.